Hi, I'm Dr. Duffy again. This is the final and sixth uh, video in a video series on tips for seeing a psychiatrist. This one is on stumbling blocks in seeing a psychiatrist, and you may not actually think they're stumbling blocks when you finish listening to me talk about it. They're really sort of the warp and woof of psychiatric treatment. I want to prepare you for seeing your next provider. Oh, sorry. All right. This is my little dog, Sophie, who was taking a nap just a minute ago. I want to prepare you for seeing your next provider by talking about some of the common stumbling blocks in seeing a psychiatrist. While your student fees are paying for you to see me, seeing a private psychiatrist can be expensive if you don't have adequate insurance. Depending on your financial resources, you may feel like you can't afford to see a psychiatrist as frequently as you need to. Sometimes the sessions are short and you can feel like you didn't get to things you wanted to get to. If you prepare in advance by having some issues written down that you want to discuss, it may save you time. Keeping your goals in mind can also be helpful and make your sessions more productive. But sometimes a too great insistence on relevance is the surest road to irrelevance. Don't overdo it. You may feel it's disloyal to talk about your family or friends, and you may feel you're going against your family's wishes by seeing a psychiatrist, since they feel you're wanting to see one possibly means that you're not trying hard enough, that you haven't tried hard enough already. You may feel embarrassed to talk about what you see as your shortcomings. While at 18 you are considered able to consent to treatment, including medication, it can feel like you're risking your relationship with your parents or your peers who may not believe in psychiatrists and are worried that you might get addicted to medicine and will be using medicine as a crutch instead of being strong. And it's understandable that they'd be worried about you, and I think it's always good to have parents that are really that involved and care about you, that they have an opinion and are willing to, talk with you about it. The odd thing about the stumbling blocks is that they're not just things that get in the way, they actually are the therapy. The particular kinds of obstacles may directly relate to your conflicts. For example, you may have trouble trusting the psychiatrist because of past experiences of abandonment or mistreatment by others who were supposed to be taking care of you. What you unconsciously presuppose about the psychiatrist being like other people in your life and how you may treat them like others in your life is called transference. Now, when the psychiatrist does that to you, it's called counter-transference. Not only is this part of being human, but it provides you and the psychiatrist opportunities to understand yourselves by exploring the transference and counter-transference. Everything that happens in the treatment is grist for the therapeutic mill. The same thing happens in sessions with your therapist, and as well in interactions with your friends. When these feelings get expressed in behavior in the session, such as by withholding information out of mistrust or trying to placate the therapist, it's called acting in. When it shows up as behavior outside of the therapy, such as missing appointments, not doing homework, or missing your medications frequently, it's called acting out. I say this not to blame you. Acting in and acting out are simply part of the therapy. When you take the opportunity to stop doing the behaviors while staying aware of the feelings and try to understand what it represents, that's really when therapy begins. Another stumbling block in therapy that is also a tool is our human tendency to keep recreating situations we don't understand as a way of mastering the situation. For example, you may be passive in your sessions and wait for the therapist or psychiatrist to do all the talking, just as you might be passive in social situations and wait for others to do the talking. You recreate in the treatment sessions an analogous situation to real life. And that becomes an opportunity to understand it and practice new ways of handling it in the safety of the treatment. For example, if you have problems paying attention in class, you'll drift off in our sessions as well. You can help yourself remember more of what I say by writing some of it down before it evaporates. Sometimes communication itself is a stumbling block. It's important for both of us to ask the other to make clear what they mean by what they said. If I told you what's good for the goose is good for the gander, you may have no idea what a gander is because you didn't grow up on a farm. Now, if you told me that your roommate looked like Norman Reedus if his mom had used drugs during her pregnancy, I wouldn't know what you were talking about either. You don't have a choice about which psychiatrist at GCSU to see since I'm the only one. But once you're through with seeing me, you have more choices. If you find that you and the new provider don't hit it off and you've given it the college try, then look around. Remember that you can see anyone in the state of Georgia remotely during the pandemic. Sometimes you find you are a visual learner and the psychiatrist is an auditory learner and you just don't seem to understand each other. You just don't click. Sometimes he's chromosomally challenged and has only one X chromosome and you need someone with two X chromosomes. You may be coming to see a psychiatrist to lower your anxiety and find that the very act of coming to a psychiatrist makes you more anxious. This does get a little better as time goes on. By the way, the two times you want to come to treatment are when you want to go and when you don't. Sometimes when you don't want to go is when you need to go the most because something's going on to make you not want to go, and that can be looked at very productively. Sometimes what holds you back from making progress in psychiatric treatment is that your daily lifestyle is sabotaging your progress. Lack of sleep from a schedule that's overbooked results in oversleeping and missing appointments. Marijuana undercutting your memory, motivation, and response to medication can sandbag your recovery. One frequent mistake that people make is believing that the medication is going to work right away and giving up if it doesn't. They also believe mistakenly that the side effects are going on forever, when in fact they usually diminish over time. Sometimes when people have become asymptomatic after some weeks of being on medication, they think they don't need it anymore. With an antidepressant, in antidepressant treatment, it takes longer to treat the brain than it takes to make the original symptoms go away. A good rule of thumb is to take an antidepressant for 1 year from the time you start to feel like yourself. Sometimes a person is just not ready for therapy. Maybe their life is not that bad and they don't want to put up with the frustration, expense, and effort of going. They might be going in the first place to please someone else. If they stop, however, they're gambling that what they don't know won't hurt them and that they will not get any worse than they are. Starting with the new provider might be made more difficult due to experiences with the previous provider. For example, you might wonder if the next provider is going to stop seeing you after 4 sessions like I did, or give you this onerous homework. Ending with a psychiatrist can bring up all sorts of unrelated feelings about past losses in your life. If you're having that happen to you, talk about it in your last session with me and carry that over into your session with the next provider. It's normal when you stop after brief treatment to feel unfinished. You are unfinished, to feel abandoned, angry, and devaluing. Talking about it with me is yet another opportunity to understand yourself. Thank you. I wish you the best of luck in your therapy. Keep at it. Keep working at it. You can get somewhere. Just don't give up. Thanks.